Welcome back. My name is Dr. Nick Cartaya. I'm a physical therapist and obstacle course race coach. It has been a very long time since I've recorded one of these videos, and I'd love to get started on doing some more for you for YouTube. And I wanted to get back on the wagon with something that I cover pretty much every single day in the clinic, and that is exercising with pain. Now, what exactly does that mean? That means that when you're coming in and you are doing some form of exercise, that you have some discomfort as you go through the motions of that exercise. I'm going to break down what it means, what you can do about it, and how to safely continue to exercise despite pain. But as always, don't forget to like and subscribe this video. Follow me on Instagram at Dr. Nick Cartaya OCR for all things physical therapy, obstacle course racing, Spartan race, and hybrid athletics. Now, when I'm in the clinic, one of the biggest goals a lot of my patients have are to be completely pain-free, in their life, or to do a certain thing that they love to do, a hobby, activity, whatever, without pain. Now, some of these people who come in have been in pain for years, and sometimes they've given up on getting back to what they love to do. And my job as a PT, I tell them straight out, it is not to get you out of pain. It is to get you doing things you love to do. So how do we go about doing that? Well, the first thing is to identify, what can't you do? If you're a runner and you haven't been able to run for a certain amount of time, obviously the goal is to get back to running. But for a lot of my older individuals, it's, to walk through the grocery store without pain. Sometimes it's to pick up your grandkids without pain, to get on the floor and play with those kids without pain. Go for your favorite hike on the weekend. It really doesn't matter what it is, as long as we have a roadmap and a target point as to we have something to work towards. The next step is figuring out what can we do that's, almost that activity, but may not be exactly that activity. What does that mean? Well, that may mean, walking. If someone wants to get back to walking their dog, it could be, walking around their house and seeing how it feels, and then slowly progressing from there. Taking a shorter hike as opposed to that longer, 5-6 mile hike. Go for a 3-mile hike. We can find ways to adapt these goals to meet people where they're at. Because it's about encouraging to move. It's promoting movement. That's what a physical therapist does. A physical therapist does not get you out of pain. A physical therapist encourages people to move in spite of pain. Now, why do we do that? Well, the biggest reason I do that is because life doesn't sit still. Time doesn't stop. You want to be able to do all these things. And the second reason for that is because healing times for everything in your body takes time. Muscles, tendons, ligaments, joints, bones, everything takes a certain amount of time to heal. And you don't want to be left sitting on the sidelines while you wait for that thing to heal. Now, granted, there's some caveats to this. Like, if you break a bone, you need to splint it, and, keep it set for 6, 8, 10 weeks or so, depending on the bone, the severity of the break, things like that, to ensure that it heals properly and nothing else gets fucked up. But a muscular injury, a tendon injury, a ligament injury is a little bit different. A ligament injury and a tendon injury, they may not see full healing capacities for up to a year after their original injury. A muscle injury is going to be a little bit shorter. It's going to be into that 6 to 12 week range. Tendons and ligaments, they're going to be a little bit longer. And the reason for that is they don't get a lot of blood flow. Does that mean you need to wait until you're 100% for your tendon and ligament, whatever to heal? Absolutely not. We can find ways to modify. So how do we do that? One of the things that I like to do is to use the stoplight analogy when it comes to exercising with pain. Now, I've heard other PTs say something similar, or the ranges might be a little bit different, but the gist of it is basically the same. You think about exercise with pain like a stoplight. So the way I see it is that we're using our classic 0 to 10 pain scale, which, while I'll get in later, is something I hate to use. But if we're using our 0 to 10 pain scale, 0 to 3 out of 10, green means go. You're good. Go for it. 4 to 5 is your yellow light, where, we're pushing into a little bit of discomfort. We got a little bit of caution, flags going on, but you can still go. Anything above that, though, we need to modify. Now that, before we even stop the activity, we can find ways to change it. What does that mean? So, for example, when it comes to a runner, and they say they want to go for a 5-mile run. So they go for that run. At the 5-mile mark, they get 6 out of 10 pain in their Achilles. Well, what do we do on the next run? Say next time we say, okay, what did it feel like at 3 miles? They're like, oh, is that a 4 out of 10? Okay, great. Let's hang out there for a little bit. Push into that discomfort, but not too much. So we're still getting those benefits of running. We're still stressing the tendon in a way that we're not going to lose, a ton of the stiffness or whatever is going on. And we can still do the activity that that patient or client wants to go back to doing. Another thing that you can modify, not just distance, but volume. Let's take that same running example. You're on that 5-mile run. You run at like a 9-minute pace, and that brings you up to that 6, 7 out of 10 pain. But if you run on that 5-mile run at an 11-minute pace, and your pain sticks at like a 4 to 5 out of 10, then we're okay. We're still into that green-yellow range where we can continue the activity, but not pushing that injury to the point of we're going to make things worse or suffer a setback. Another thing that you can modify is load. So I'm going to change examples here. You're bench pressing 200 pounds, say with shoulder pain. Say when you do that 200, you get that 6 out of 10. 150, you're down to a 3 or a 2. So that's a way where you can modify load, you can modify distance, you can modify intensity, you can modify even range of motion. If it hurts to go from, a full squat, going ass to grass, you can take it, halfway. You can modify those joint angles, for the time being, where you're still getting some benefit, but again, we're not stressing that injury to the point of we're going to put you back. Another way to do it that I like to teach is to pay attention to the type of pain that you're having. So if your pain is in that 5 out of 10 range, but it feels just sore, like a pulling type pain, it feels achy, like you just did a really hard workout, I encourage that because that's fine. That is that regular muscle soreness. That is those calcium ions that are being released into the muscle belly, all these time over tension type of stuff where we associate with soreness. That is all good. But if you're at that 5 out of 10 pain and it feels like sharp, it feels like a stabbing sensation, you have shooting pains, you have worse, like say numbness or tingling into an extremity, then that's something where I encourage to back off. Other things that you can do are even changing the exercise entirely. So if we are squatting and it hurts to do a single leg squat, but it doesn't hurt to do a double leg squat, you could start with the double leg until you feel more confident in the range of motion, you feel a little bit more stable, and then you can try the single leg again. You could also change the exercise where you're working similar muscle groups. So for example, if we're talking about a hinge pattern with the deadlift, if you have back pain with a heavy deadlift, you could swap it out for another hinge type movement like a hip thrust. There's really no limit to what you can do while exercising with pain. And you can always find ways to modify. My final thoughts are this. Pain is never a reason to stop doing anything. Pain acts like a warning sign. Pain is not a bad thing. It's something that you can be like, hey, let's put the brakes on this, not entirely, but for the time being. And it's my job as a PT to guide you back to doing those sorts of things safely and effectively, despite pain, which never, ever, ever coincides with damage. Thank you for your time. Again, like, subscribe, and share this video. Follow me on Instagram, and I'll see you in the next one.